Good morning, everybody. It is Thursday, May 11th. Welcome to the County Council. We are continuing our full council deliberations on the FY24 budget and CIP budget. Let's first start with our consent calendar for the FY24 operating budget. May I have a motion to approve the consent calendar?
Second.
Moved by Councilmember Fani Gonzalez, seconded by Councilmember Balcom. All those in favor? And that is unanimous by all those present, including Councilmember Albornoz, who is under the weather and joining us virtually. Good to see you, Councilmember. And today, we're going to move to work sessions on the FY24 operating budget and the FY23 to 28 capital improvements plan. We have a number of items in the HHS portfolio, the first of which is the Office of Food Systems Resilience. And I see the chair of the HHS committee who is on Zoom, and I will turn it over to Chair Albornoz.
Thank you, Mr. President. First, my apologies for not being able to be present in what can only be described as Shakespearean irony. I tested positive for COVID this morning. For the first time, so as I'm just about to present HHS's budget. But I want to thank all of my colleagues, and I especially want to thank our really remarkable staff for all that they have done to put together the packet before you today. As you mentioned, Mr. Council President, we are starting with the Office of Food System Resilience, and of course we are all very excited that Ms. Bruskin has now fully on board and has, no surprise, hit the ground running. This initiative, of course, is critical to the success of addressing our food resiliency strategy, not just within local government, but in connection with and partnership and alliances with a number of nonprofit organizations. And so we are thrilled to be here today. I am going to turn it over to staff to walk us through this packet. And with your indulgence, Mr. President, what I'll do is after each category, I'll come in, provide some context, give a little overview, but then turn it over to staff to walk us through the nuts and bolts.
Sounds like a good plan.
Good morning. So we are discussing the Office of Food System Resilience, the FY24 recommended operating budget. The HHS committee met on April 17th and voted 3-0 to recommend approval of the CE's recommended budget of $1,118,131 for the office. The item was identified as high priority. The funding is just changed incrementally, just the annualization of personnel costs, general wage adjustment, and group insurance adjustment. There was a reduction of one-time funded items in FY23.
And this was a 3-0, Mr. President.
Yes.
Very good. Ms. Bruskin, welcome to the council in your new capacity, your first time supporting the county executive's budget, and this is certainly a portfolio that you know well. Can you share with all of us how the onboarding and the formation of this new endeavor is going?
Yes, good morning, everyone. I'm very happy to be here with all of you and appreciate the opportunity to get to share a little bit of an update of what we, and when I say we, it's still currently I, but soon to be a three-person we will be, have accomplished so far and will be working on in the coming year. We have been working on a strategic plan, which we'll share as soon as it's approved on the executive side. But the focus of the Office of Food Systems Resilience really is bringing a food systems lens to all of the county's initiatives related to food. And so that lens really is focused on centering equity, innovation, strategy, and systems thinking, and across 4 major areas of the work that the county engages in related to food. And so those are in the buckets of investment, and so that obviously could be actual dollars like we're discussing today in the budget. It also could be investment of resources like land or infrastructure, which is also really critical to moving forward our priorities. Also focusing on policy, so the opportunities to both create legislation, but even more importantly, implement it in the way that it's designed. Focusing on data collection. There's very limited hyperlocal data related to food, and that's everything from the number of residents who are experiencing hunger to our local levels of food production, and we never really look at all that data in a systems-based way alongside each other. So there will be a focus through one of the positions, which is currently being recruited, on data collection, analysis, and communication, because transparency, both in our baseline of where we are now, as well as achieving the metrics and the goals that we establish for our work of our office, as well as our work collectively as a county, is critically important, both for interagency collaboration as well as community partners. And then finally, really facilitating collaboration. So we have a very solid and well-connected network of the food community in the nonprofit and private sector, but the focus of the office will be in building bridges and breaking down silos within government related to food, so that we are looking at our opportunities to expand local food production alongside our strategies to build food security and food access and economic opportunity and sustainability across our food system, both locally and in collaboration with our partners at the state and the regional level, because there's a lot of really important work happening beyond our borders that directly impacts what we see and the resources that we have here. So there's another position that is focused on that collaboration, policy, and community engagement piece. And so both of those are in recruitment right now, with hopefully onboarding those two staff in June.
Exciting work and exciting potential. And so you are you are definitely the right person at the right time for this new position and this new endeavor. I don't see any comments from colleagues, and so we have a recommendation from the HHS Committee for the Office of Food Systems Resilience. All those in favor of the HHS recommendation, and that is unanimous by all those present. Thank you, Ms. Breskin.
Thank you so much. I look forward to our partnership.
Thank you. And I will turn it back to the HHS Chair to walk us through the Guaranteed Income NDA.
Thank you, Mr. President. So this is another really important and exciting initiative that was started by the previous council, worked closely with Councilmember Jawando and his team with support of the entire council. We are the first county in the state to initiate a guaranteed income initiative here in the state of Maryland. This has been proven to be successful in many other parts of the country, and so we are thrilled with the progress to date. And we were recently visited by the new Secretary of Health for the state, and who expressed his deep appreciation and support for this initiative and was very impressed by it. So we are making great progress, and with that, I'll turn it over to staff to walk us through this packet.
Thank you, Chair Albernos. So we are discussing the FY24 recommended budget for the Guaranteed Income Non-Departmental Account. The HHS committee met on April 24th and voted 3-0 to recommend approval of the CE's recommended budget of $3,298,344 for the Guaranteed Income NDA. This item was identified as high priority. The change from FY23 to FY24 was around $734,000. This amount will go directly to the client assistant payments. That is for the 300 residents. No, we'll take clients. 300 residents enrolled in the program. Most of the enrollees, I believe, were brought on board in between July and November of last year. So we have 300 people enrolled in the program, and this will continue the payments to them. I'll just note that evaluation of the program is underway. Morgan State University and the Urban Institute are the two entities providing evaluation for the program. So hopefully this time next year or a little bit before this time, we'll be able to share the results of the pilot and how it's going. Thank you.
Thank you very much for that update. I know we'll look forward to the analysis that is done by the partner organizations to see how our investment in the community is paying dividends, which I trust it will be. So not seeing any comments from colleagues, all those in favor of the HHS committee recommendation for the Guaranteed Income NDA, raise your hand. That is unanimous by all those present. Thank you. And now on to the DHHS overview and administration. Mr. Chair.
Thank you, Mr. President. And I'd be remiss to not acknowledge the great work of my colleagues on this committee. I especially want to thank Councilmember Sales and Lutke, who, no surprise, did a fantastic job with their first HHS budget. HHS, as my colleagues know, is the largest executive branch agency, and so this required multiple sessions. And our colleagues in HHS have really been on the front lines, certainly prior to the pandemic, but especially during it. And they, like the rest of the country, are feeling the impacts. They are struggling with recruitment and retention, but we are fortunate to have remarkably dedicated staff that have continued the great tradition and work of our Department of Health and Human Services in Montgomery County. And I especially want to thank Dr. Bridgers and his team. Although he is working in an acting capacity, he has really just done a fabulous job of not just leading the department, but to help build bridges and to help keep the council close. And the communication we've had has been very strong. We did thoroughly go through the entire budget to try and identify any potential savings because we know that we are all doing the same thing in each of our respective committees. And I do have some good news. We did an exhaustive review, and I'd like to propose two approaches that I believe can reduce the fiscal impact of DHHS programs on the reconciliation list, but still, and most importantly, maintain essential service levels. The first would relate to using the previously identified ARPA funds for the recommended food staples funding level. And as I shared in the memo that I shared with colleagues earlier this week, we would propose removing $6 million from the reconciliation list and using $6.45 million from ARPA funding to support this program in FY24. An absolutely critical piece of this recommendation is that DHHS and our new established Office of Food Resilience, who we just heard from, must develop a strategic plan that we would then review in partnership with the executive branch to ensure that the strategies that we initiate are sustainable. And that in FY25 and beyond are done in a way that's the most efficient possible while meeting the most needs. The second proposal relates to the additional COVID funding the executive proposed for several efforts, including testing, vaccine support, wastewater surveillance, and isolation sheltering for individuals who are homeless and also test positive for COVID. Altogether, the executive recommended $5.8 million for these efforts in FY24. And we proposed reducing the reconciliation list by $3.3 million and providing $2.5 million for these collective efforts. We have the infrastructure in place. We still have a very large stockpile, both of test kits and masks in our warehouse that are ready to roll. And we don't face the same challenges in procurement that we did during the pandemic. And so if, God forbid, we experience another strain or another spike that puts our overall public health system in jeopardy, the council has many tools at its disposal to be able to appropriate funds on an emergency basis. But let's hope it doesn't get to that. And in the meantime, we think we can find some savings from that. So all told, the savings would be $9,336,704. And I'll also note that as we heard in public safety earlier this week, public safety and HHS made up the lion's share of the vacant positions that we have in county government right now. And we did our best in our review of HHS's budget to see if any of those positions could be eliminated. And unfortunately, what we found was many of these positions have revenue offsets. Many of these positions are in critical functions, for example, in child welfare and in school health. And not surprisingly, we're having a hard time recruiting nurses and psychologists and case managers as the entire country is right now. And so some of those vacancies have very legitimate reasons for them. The department did factor in some additional lapse, acknowledging that it's taking them a lot longer to fill these positions because of that challenge. And the committee accepted those recommendations. So, and I'll end with this, some of the positions are grant funded and some of them are being filled by contractors. But we did hear from the department and later in the presentation we'll ask Dr. Bridgers to expand. There have been very aggressive efforts by the department to fill these vacancies as soon as possible, because we need all of them. And very few of them have been open for longer than a year. They're reasonable explanations for a lot of the vacancies that the department has. So with that, Mr. President, I will turn it over to the team to walk us through the packet, and I didn't know if Dr. Bridgers wanted to make any opening comments.
Dr. Bridgers.
Good morning, Council President Glass, HHS Chair Albornoz. If I sound a little, have a deeper baritone this morning, the seasonal allergies are kicking in. So I did, do all of those public health precautionary measures to sit in on the session. A couple opening remarks. We have worked diligently with our Office of Human Resources to think strategically out of the box, to question the status quo when it comes to recruiting and retaining our clinical staff, psychiatrists, social workers, and staff in general. As Council HHS Chair Albornoz indicated, we've had a high level of attrition post-COVID. We are COVID battle-worn, if you will. And so we need to look at the resiliency across our agency and the work that we do to realistically provide the much needed support to the community. We've hosted virtual job fairs. We've attended every university and or college in Montgomery County. We've attended virtual sessions, we've networked, we've assessed different strategies going forward, and we have made some significant strides. But quite frankly, it's not enough to meet the demands. And so we continue to work with our staff, we continue to network, we continue to work with local authorities. We've even begun working with internships and looking at creating a pipeline, developing a pipeline to recruit individuals who are graduating from college or who are in programs that could feed into the work that we do. So we are looking outside of that proverbial box. But we need help and we need support. And in that vein, we will continue to be a front-facing, public-serving entity for this county. Thank you.
Thank you, Dr. Bridgers. Councilmember Ludke.
Thank you, Mr. President. I just want to say a huge thank you to you, Dr. Bridgers, and to the rest of the team for the thought and care you've given to trying to be collaborative with us on all these issues, and just thinking about the pipeline for folks working in these positions. If there's anything that could positively be born out of going through this pandemic, it's often that times like that and incredibly stressful times bring to bear people who are sparked to action, and it may take us a bit of time for them to get through that pipeline, education pipeline, in order to reach their goals of fulfilling these types of positions and doing this type of critical work. But I know that there were folks who were inspired to be a part of the solution moving forward. So thank you for your ongoing commitment to I know the many internal housekeeping things you all are doing over there, and I just wanted to say I really appreciate it. So thank you.
I too want to say thank you. Important work that has been taking place over the last 3 years, and we know that the need has not gone away, it's only grown. And the collaboration that this budget shows, and I also want to express my appreciation to Councilmember and Chair Albornoz for the thoughtful amendment, which we will take up after people have other comments, but thank you for taking a third look at the budget to figure out how we can streamline it while providing important services to our residents. Councilmember Sales.
I just want to echo the sentiments of my colleagues and want to thank Dr. Bridgers for his partnership and being proactive as well. We have a lot of talented individuals, not just in our county, but across the state. And so thinking outside of the box on ways that we can better market the opportunities. Public health positions are, I know, in demand across the country. And so the talent pool is, it's going to be, we're going to have to be just as competitive and aggressive in recruiting and opportunities to retain. So just please keep us in the loop as you develop and think about strategies to reach out and how we can also support the staff that's there now as well. We were talking already about this yesterday with other departments that, you know, if we're not hiring the appropriate staff, we're going to experience burnout. And right now with the public health challenges that we face, especially with our communities of color, we have to ensure that this is top of mind. So thank you and your team for making it a priority as well.
Vice President Friedson.
Thank you, Mr. President. Just want to echo comments of colleagues. First of all, thank you to you, Dr. Bridgers, for your leadership and your collaboration. It really is helpful. This is a very challenging time for all of us as we have tried to navigate all the various issues at a high level and the individual challenges that residents have been facing, and many of those are directly interfacing with your department and with your team, and really appreciate all the work that you do. I appreciated, along with several colleagues, being able to join the boards, committees, and commissions. It was great to be back in person yesterday, and really want to express my appreciation to them. Your department at DHHS has more boards, committees, and commissions, I think, than anyone, and I don't think it's particularly close. And it really is a demonstration of the incredible amount of talent and engagement that we have in the community, and as much as we are able as a county government to channel that interest in getting involved and to benefit from all of the expertise that we have in our community, I think is hugely helpful. And last night was a refreshing reminder of that. And so I just wanted to express my appreciation to them as well as we did last night. And lastly, I just want to wish Chair Albernaz, hope you have mild symptoms, my friend, but mostly, in addition to that, thank you for your leadership of the committee and looking through this budget. Really appreciate your thoughtful suggestions. I'll be supporting them as we take them up in this, and just want to thank you for your leadership in particular, and the committee for your hard work on this. It's not easy in a tough budget like the one we have in a moment like we are in to go through the Health and Human Services budget, and so I know you all have done important work and wanted to express my appreciation for that.
Thank you. So Chair Albernaz, let's go back to the two amendments that you offered for this budget. One is to the food staples program, swapping $6 million in general operating funds for $6.45 million in ARPA. Can staff, did I get that correct? Yeah, Ms. McGuire.
Yes, the proposal, the executive recommended $6.15 million of county funding to support both food staples as well as an item for the, I believe it's called the farm to food item, that's correct. And so the recommendation, there is $6.45 million of ARPA funding that the council had previously identified for food staples and had not been appropriated in the course of working through all of the various ARPA funding components as we've been discussing. And so because those funds are available, I believe the chair's proposal is to reduce the county funding of $6 million, reserving the portion that's associated with that other food to farm program. So $6 million would come off the reconciliation list, and the 6.45 would support the food staples program through the ARPA funding. And again, just to provide that continuity, as was expressed, certainly an important part of that is to come back with a plan for strategic and sustainable approaches going forward.
Very good. So just to reiterate for a third time to make sure we're all right, the HHS chair is moving to reduce the food staples program by $6 million in general operating and use $6.45 million in ARPA to fund that program.
That's correct.
Very good. Is there a second for that motion? Seconded by Councilmember Luedtke. Any comments, Councilmember Jawando?
Morning. Yeah, and I have a comment on this item, but I also just like to ask to be noted as the affirmative for the previous two items, guaranteed income and the resilience office and the consent calendar. So I appreciate the work and hope you're feeling better, Councilmember Albernaz. The Manna Food Center obviously has been, with this food issue has been something that it's been a community-wide response and something that we've all been very proud to work on. As I've said before, I'll never forget, 3 years ago when we had never had a mass food distribution in Montgomery County. Now we're doing it every day, multiple days a week, and our community has stepped up, and we've funded it in with partnerships. So this is I agree with the motion. I just wanted to ask if I saw that the committee included Manna Food Center as restoring that reduction as a priority. Is it possible that would it be a friendly amendment to move that funding into this food staples program, that $300,000 as a high priority? Or maybe it's staff and you, but I would, and we can take it up separately. But I just thought I see it as all the same bucket, and they've obviously been a core partner. So just wanted to kind of ask that question with the president's permission.
And I would just like to clarify that would need to be with general funds and not associated with
Not
the
with
ARPA.
ARPA.
Correct. It would not be able to
And
be.
so this amendment would move the entire amount. Could you explain
So
to me then what is general funds and what's ARPA?
Yes.
Thank you.
So the ARPA, the proposal is for the ARPA funding to apply only to the $6 million that the executive put in for food staples specifically. The food staples program is one that is primarily contracted with the Capital Area Food Bank and then distributes food through community providers from that vehicle. That's the program that is suggested to be replaced by the ARPA funding. The ARPA funding is higher than that, but would need to continue by the $450,000, but it would need to continue to support that same program because that program is ARPA eligible. I do not believe that the separate funding that was recommended for reduction and that Manna is requesting to be restored and that the committee did place as priority would not be ARPA eligible.
Got it. Okay.
And so the rest, certainly the council can change the priority, but it would be general funds.
Understood. Thank you. Well, I support this move. I think it's an important and appropriate use of ARPA funding. Obviously, we all are committed to the food work and worked closely with you, Councilmember Albanaz, and the whole council to do this over the last several years. So I think it's a good suggestion, and I'll come back, get in the queue for Manna when we're at that point.
Very good. Council Vice President Friedson.
Yeah, quickly, as I said, didn't bury the lead. I'm very supportive of this. Just wanted to note, as I did yesterday, I had raised the interest previously when we had this initial conversation on ARPA about whether or not it would make sense to use some of this funding in order to capacity build and look at aggregation facilities and other long-term benefits. I still want to pursue that. I still think we need to pursue that. We still are going to work on that. But I appreciate the urgent and immediate need, as I mentioned previously, and I think this is an important and thoughtful suggestion here. We've got to provide food. We need to build capacity, but in the hierarchy of needs, this need comes first, and so I support the suggestion, but did just want to note that because it is different from a suggestion that I had publicly made previously, and so I just wanted to explain why I'm supportive of the thoughtful suggestion from Chair Albernos. With that, I'll yield back.
Very good. So the HHS chair has a motion that would use $6.5 million in ARPA funding for the food staples program. All those in support of that amendment, and that is unanimous. And Mr. Chair, there was a second amendment regarding COVID testing.
That's correct. So the second amendment pertains to a reduction in the county executive's recommendation to continue COVID operations and COVID support. What we learned through the pandemic was it was important to stockpile both of our test kits and all of the supplies that were necessary. And we are fortunate, as we learned through the process, that we continue to have a very healthy stockpile of all of the supplies that we need. But we felt that the county executive's recommended budget could be reduced in order for us to both find some savings, but also acknowledge what's happening on the ground right now, which is that we don't have the same procurement challenges that we had before. If we do need to access test kits or masks, we would be able to do that and turn that around very quickly. And we also did feel that it was important to continue the water waste analysis, and the irony is, again, I tested positive for COVID this morning, but I do think that it's responsible and reasonable to reduce the amount recommended by the county executive and still be able to have the infrastructure that we need to meet needs if COVID were to rise again.
And I'll ask staff, Ms. McGuire.
Thank you. So as Mr. Albornoz was mentioning, the executive did recommend significant increases in COVID funding, one time only, for a number of different purposes. All those purposes together total about $5.8 million. And the intention of this amendment would be certainly to continue each of those elements, as was mentioned, the wastewater surveillance, vaccine support, also sheltering for individuals who are homeless and need isolation as a result of being COVID positive, and still to continue with some testing supports as well, but to reduce that overall level in order to be responsive to conditions as they are changing and evolving. And again, reflecting the fact that we do have significant testing supplies in inventory. So the suggestion is to reduce that amount by $2.5 million. And so the resulting amount would be I'm sorry.
Yes.
I'm sorry. Ms. Clemens Johnson can correct me on that. Go ahead.
So the recommended total amount of funding for the COVID response would be $2.5 million, and that would be savings of $3,282,975.
Thank you for clarifying that. And so that would again be the change in the funding. I think a couple of things about that. One, certainly the department can, while the intention is to support all of those elements of the program, the department can be strategic in how it wants to allocate those relative to the priorities as needed. And again, certainly if conditions change, certainly we know the council will be responsive.
And Dr. Bridgers, that the amount that we're moving towards provides you with the flexibility to conduct this important work?
Thank you, Council President Glass. You know I was doing my due diligence, just making sure, because I want to make sure we have enough funds to, while we support the county executive recommendations and HHS committee's adjustment, we want to make sure that we have those surveillance mechanisms in place, because we can anticipate, based on forecasts, that we may see either wavelets in the future or in the fall and testing, and so we will make the necessary adjustments. And if not, we will return to council and provide council with an update for any additional needs, but we will see that. The other point I want to make is with the surveillance system, the wastewater system, we are thinking strategically as an FYI to consider opioid use and surveillance of that. So that is a great sentinel system, and I wanted the council just to be aware. So we are, again, strategically thinking about our way forward and how we can keep a community safe. But the short answer is yes.
I appreciate that, and I think what's most important about in this conversation is, unlike 3 years ago where we had to quickly prepare for the public need, here there is still a maintenance, and so if we need to ramp up, we can easily do so. Very good. So the HHS chair has made a motion. Is there a second?
Second.
Seconded by Councilmember Luedtke. Any comments? Councilmember Stewart.
Thank you. Dr. Bridges, I had a question, and I fully support this amendment and thank Chair Albornoz for bringing it. And I don't know if this is the right time to ask this question, but I think it's related to this because a piece of this is housing of people with COVID. And I know as things have evolved, that was done less so. But I'm also thinking about the report that was received yesterday on the increase in homelessness. And we can get to that later, but I just didn't know if there was any intersection here with the funding in terms of COVID and housing people and the increases that we're seeing regionally, not just in our region, not just in Montgomery County, on the numbers of people who are unhoused. And we can talk about that more in a moment, but while we had you talking about the COVID stuff, I wanted to raise it.
Thank you, Councilmember Stewart. Great question. And yes, we've had conversations with our acting chief, Ms. Branda, who's here joining me today, and with Ms. Treadvance, who is our chief of our service, our children, youth, and families. So we are looking at the intersection, but with Title 42 ending today and the public health emergency ending today, and we know that the point in time data that was provided yesterday. So we're looking at the triangulation of all of these data points to ensure we have housing stabilization. The need should there be outbreak or wavelet, and so we're looking at all the points across HHS, even in our congregate spaces where we see our individual and disability citizens and our assisted living facilities. So we're looking across HHS to determine the impact that will have on our ability to safeguard and accommodate folks for housing. So the answer is yes, we are looking at that. We haven't come to a final decision or determine on the way forward, but we are making that assessment now because it will be a reality very soon.
Thank you. So there is a motion on the table. All those in support of the transfer of the COVID response funding, raise your hand. That is unanimous. Thank you. Again, thank you very much to the HHS chair for these two thoughtful recommendations. Councilmember Balcom has a comment.
So I don't know if now's the time to talk about the mobile health clinic, so.
Ms. McGuire.
If the council wants to go through each of the service areas, we are prepared to do that, and items might come up then. If the council does not want to go through all the service areas, then that's up to you.
This is a large budget, so yeah, I think it behooves us to go through.
Yeah, I was going to give a brief recap of our committee session that helps related to this issue. So when we had the committee session, we talked about the actual physical mobile truck first. And then there was a later discussion after we talked about the truck and what to do about the truck with the people and the personnel. And so during committee, we had sort of a less than perfect reconciliation of those two pieces because they were considered separately, and we subsequently learned that the personnel were already in place waiting for delivery of the truck. And Dr. Bridgers, am I correct? And Dr. Rogers, that the truck is now here. Or almost here. Here?
Christopher Rogers, Acting Chief Public Health Services, for the record. The truck is not here. The chassis is still being built by Winnebago. And once we get word from the vendor that the chassis has been built, the chassis will be delivered to the vendor for the vendor to continue with their outfitting. We have not received a date as to when the county will receive delivery of the vehicle. My hunch would be early next year. So what we're planning to do is to modify the mobile health clinic services in pop-up capacity. So we'll provide pop-up services in targeted communities. Once we receive the vehicle, the county needs to outfit it with technology and some other things we need to do, and then we'll be able to provide all our services on board the vehicle.
Right, and so to Councilmember Balcom's request, and I think she wants to make a motion.
Hasn't done anything.
Sorry, sorry.
So hold on, let's get us back on track for a second. I want to yield to the HHS chair if he wants to tick through some of these, or I'll turn to Ms. McGuire as well.
Absolutely. So I think that's a good preview. I think it would be helpful to go through each of the respective line items so that we have the full context. Councilmember Lukey's right to make that point and ask that question, but that will be part of the public health discussion, and we can provide a little bit more context on why the committee decided priority versus high priority. But I had a conversation with Councilmember Balcom about this, and when we get to that section, I think we can elaborate on this.
Okay, so Ms. McGuire, if you want to take us through.
I will apologize. This is a very large budget with a lot of pieces and a lot of moving parts. So we did appreciate diving in with some of those macro issues, and we will continue with a few other macro issues, and then we will also go through the service areas and identify items for further discussion. Just briefly as an overview, do want to indicate that the Department of Health Health and Human Services has a significant funding increase in this budget. The general fund is increasing by 11.8%, and overall the department total is increasing just under $49 million. Now, many of those dollars are grant funded increases as well, and again, we'll highlight those as we go through. There's a breakdown of the service areas increases with FTEs and dollars on page 2 of your packet. And again, just would highlight that some of those large numbers, particularly in services to end and prevent homelessness, do represent grant funds, and particularly their ARPA funding. Speaking of ARPA funding, on the top of page 3 of your packet, again, this is an issue that certainly the committee has discussed in multiple years, but again this year, as you can see, there are some large decreases in ARPA funding that has been expended and is going away. There are some recommendations in the executive's budget to replace some of those funds, primarily the service consolidation hubs, which again we'll talk about these specifically when we get to those items, but we did just want to reflect here all of the puts and takes related to the ARPA funding in DHHS. And as you can see, while DHHS certainly has had a lot of ARPA funding over the years, those number of items is decreasing, and we are coming down to where the remaining ARPA funding in the Department of Health and Human Services will be in the Emergency Rental Assistance Program, the ERAP program. So again, just wanted to show that all in one place. The committee did have a discussion around the racial equity and social justice statements of the Department of Health and Human Services, as did other committees. We did note that while the department gave one sort of overarching description of its commitment to this issue, and I think certainly everyone can appreciate that the services are very related to racial equity and social justice, the department did not do sort of a deep dive of that analysis within each service area, and so the committee did request that information to come back and to have a more full discussion of those that important lens on their work. Wanted to highlight a couple of issues related to vacancy and lapse. As Mr. Albornoz said, certainly the committee did have extensive discussion around the vacancies. DHHS, by numbers, in the March 23 report, had very high, had the second highest, I should say, county department in terms of the number of vacancies. In reviewing the vacancies, we did also discuss that DHHS has a historical lapse assumption of 7.7 million. The budget did also take an additional lapse reduction of just over 3 million, so the total of 24 lapse assumed for the department is 10.7 million. So again, there was that additional recognition in the executive's budget of the hiring challenges that certainly we've all been speaking about. Also want to share that any new positions in DHHS are being lapsed for 6 months in FY24, which again, just reflects that reality of hiring. However, given the sensitivity of many of these positions and the criticality, as we've been discussing, the committee did not necessarily come up with specific positions that would be reduced, but really wanted to speak more about strategic hiring practices going forward. And certainly tomorrow on the agenda, the council will be taking up a macro look at lapse in hiring across the departments, which will certainly include HHS at that time as well. Should I pause there?
Yeah, Councilmember Katz.
Thank you very much. I was trying to text in. Ms. McGuire was moving faster than my fingers were moving. On the idea of the lapse and waiting for the 6 months, and we had discussed this with other departments as well, I believe that they should be able to advertise before so that they can actually hire when the 6 months is up. These are difficult positions on their best day to get, and the longer we advertise, the better off we are, perhaps. But I do think that would be something, and I don't know that that's a budgetary issue.
As we had a conversation earlier this week, or was it just yesterday, in fact, with the Office of Human Resources, tomorrow when we do take up this conversation about lapse, CAO Madalena will be here, and I encourage you to share that thought with him.
I was just one point of clarification on the 6 months lapse that we included. That is our estimated average time it will take to fill the position, not that we're going to hold the positions for 6 months. So it is just, we'll start the process as soon as we can, along with all of the other vacancies we'll be hiring. We just know that on average it takes 6 months. Some of them might take shorter, some of them might take longer. We're just changing the budget to reflect the reality of the time it's been taking to hire and fill positions.
Great. Ms. McGuire.
And so finally, there's one final overarching issue that we wanted to raise before we dive into the service areas, and this relates to the inflationary increase to eligible nonprofit service provider contracts. I do just want to take a minute to say that this it's been a longstanding practice, but the reason we say eligible nonprofit service providers is because there are a number of parameters and requirements and criteria around being eligible. And primarily the purpose of this inflationary adjustment has been to provide an opportunity for an increase for contracts that would not otherwise have an opportunity and are providing ongoing services with the county. So for example, if a contract is in its first year, the presumption is that it had an increase as a result of that process. So there are, again, a number of criteria. It's not universally applied to all providers. The executive did include a 3% inflationary adjustment in his budget for all eligible nonprofits. The HHS committee recommended approval of this as a high priority. What we have reflected in your packet are the figures both for HHS specifically, which has by far the majority of the funding, but also for other departments and offices. Again, the practice for many years has been to apply this apply whatever changes are made for inflationary providers in HHS to those providers that would also be eligible in other offices and departments. So we've reflected for you here the total amount for all departments at the 3% level is just under 3.9 million, and the DHHS increase alone is just over 3 million. The committee also did recommend 2 additional items for consideration above the executive's recommended level. One would be recommending adding a 2% increase, which is 2.6 million for all departments and 2 million for just DHHS. That was placed as a high priority. The committee also put forward consideration of an additional 3% beyond that and placed those funds as a priority.
Thank you for walking us through that important packet. I see Councilmember Jawando has a comment.
Yeah, just wanted to circle back to the manna issue. Is that when are we appropriate?
I think that will come up mostly
at the
under under public health with foods with the food items. MANA certainly with its contracts, depending on where they are in their contract cycle, could be eligible for this inflationary adjustment as well. But the specific increase that they're asking to be restored reflects more infrastructure and operational needs that they've expressed as an organization.
So I'll hold again. Thank you.
Chair Albanese.
Thank you, Mr. President. And so, yes, Mr. Guire, of course, did a phenomenal job providing some background. And just for colleagues, last year the council was able to add 2% on top of the 6% inflationary adjustment that was recommended. And that was received, as you would imagine, extraordinarily well by all of our nonprofit providers who are taking it on the chin with their own challenges in recruitment and retention. And by extension, they are part of government. And as we make adjustments to the department's operating budget and the salary and compensation of county personnel, it's important that we extend to the degree to which we can the flexibility for contracted organizations and nonprofits to be able to do something similar because it's very much tied to the continuity of service and work. And we will be discussing MANA later, but that's a good example. There are many organizations that have come forward, not just to the committee, but to each of us individually, saying that they need more. And unfortunately, we're just not in a position to be able to do that. So the committee's recommendation, as Ms. McGuire noted, is that in 2 tranches, 2% high priority, 1% additionally priority, we have that for consideration on top of the 3% that the county executive has recommended.
That's a really good point. You know, the social safety net has lots of intersections and things that cut across different lines and different budgets, and we're working through all of that right now. So appreciate the committee's work. We do have a recommendation for the DHHS overview and administrative budget. All those in favor? And that is unanimous. Mr. Chair, you want to walk us through the Aging and Disability Services?
Absolutely. This is Dr. Brunetto's last turn coming before the council, and so we once again.
We're still at my mistake. We had let's go back to the overview and administration. We had taken a long pause, but there's a lot more to go through. So my apologies.
And I'm sorry, just to clarify, there are so many parts that we put them all together in one packet, and so we can try to identify clearly where we are. That was the last overview item.
Got it.
We're going to enter into the administration item now, administration service area now, and also we are pausing. Our plan was to pause at each item if there are questions, and then continue to move through the service areas in the packet.
Appreciate that.
Thank you. Apologize for the, it's a lot of pieces to wrangle.
It is.
I think was
No. We'll turn it back to you to walk through.
Okay, great, thank you. So I just want to highlight that within your packet, we have provided charts of all of the service areas. So they're pages A through F. So I think as we've been discussing, a few items are popping up and that are in different service areas, or that we usually talk about in overview, but just trying to align with the budget, we decided to put everything in their service area as indicated in the budget, so that things that we usually talk about in overview, you'll see them actually within the service area that it's embedded. So public health has the most of those items, which will be our probably last discussion item. So we'll get there. So for administration, we will start with the service consolidation hubs. The CE has recommended $3 million in support for the food hubs, shifting from ARPA to county general funds. This budget will support 7 hubs across the county. The HHS committee identified this item as high priority. Are we stopping up here? Okay.
We'll stop there for consideration. There we go. Thank you. I see no comments from colleagues. Mr. Chair, do you have anything?
Nope.
You're good. Thank you. Everyone's on pins and needles right now.
Okay, our next item is within the chief operating officers is a staff, including a coding unit. So the CE has recommended $375,000 and 7 new FTEs for the COO's office. DHHS anticipates these costs will be offset by revenues, and they are identified as high priority. And so just to be clear, this will be contract monitoring staff and coding staff that will assist with all areas of HHS. And so this effort is to maximize the revenue DHHS receives and extend those services provided to county clients.
Keep going.
Okay. And so next we'll move to the Office of Community Affairs within the administration. There we will talk about the 3 health initiatives and the Black Physicians Healthcare Network. The first item is the Asian American Health Program. The HHS committee recommends approval of the CE's recommendation of $775,000 as high priority. This funding is supporting the Healthy Communities Fund, the Asian American Center of Excellence microgrants, and staff support. For the African American Health Program, the HHS committee recommends approval of the CE's recommendation of $800,000 and identified as high priority. This funding will support health education and wellness programming, the current running SMILE program, and a new program focused on medication therapy management for county aging residents. For the Latino Health Initiative, the HHS committee recommends approval of the CE's recommendation of $952,000 as high priority. This funding will support the Encuentros program and an expansion of the newly which would be an extension of the newly state accredited health. No, they're different. Excuse me. This funding will support the Encuentros program, and there will also be an expansion of the newly state accredited health promoters program. Just the Encuentros program provides non-clinical emotional support groups, and this funding will increase the number of groups and sessions and number of residents to be served. For the Black Physicians Healthcare Network, for FY24, the CE has recommended level funding of this program of $2.5 million. During the committee's discussion, they expressed the need for the department to work with BHPN to establish parameters for the program model going forward and ensure alignment with other efforts. This was a program started during COVID. The committee recommended adding $1 million to be placed on the reconciliation list. And that is the end of the administration session.
Very good.
Thank you.
I'll turn it over to Mr. Chair, Albornoz.
Thank you. I think all of us are intimately familiar with our minority health initiatives and program. They have been an extraordinary partner to our county government. They have been able to build bridges in communities that the county government can't do on its own. And their work literally saved lives during the pandemic. And so they have proven to be incredibly responsible stewards of taxpayer dollars and regularly make $1 out of 75 cents and do a really fantastic job reaching into our communities. So we were very appreciative of the executive's recommendation for the enhancement in program and funding for those initiatives and program. And we did have a robust discussion regarding the Black Physicians Network, which was a new initiative launched during COVID. I want to give a lot of credit to Councilmembers Jawando and Rice, who were involved in the development of that initiative during COVID in partnership with the African American Health Program. That program has evolved and is continuing to make great strides. And while the county executive did recommend funding in his budget, there was a 2-1 recommendation to expand that by $1 million, but all of us expressed deep appreciation and support for the initiative as a concept, but acknowledging there are challenges within this particular budget. We received very compelling testimony from physicians that are part of the network as well as participants in the network. And the hope is that this program will continue its momentum. I think it will, regardless of whether or not we invest the $1 million, but I think the $1 million will help. And so I yield back to you, Mr. President, to see if any of my colleagues on the committee or on the council have questions or comments.
And they, in fact, do. Councilmember Lutke.
Thank you, Mr. President. And thank you, Chair Albornoz, for the great summary of some of the discussions. And I wanted to try to ask some questions about the Black Physicians Health Network. And, understanding, so the African American Health Program has its own very distinct, unique initiatives. And the Black Physicians Health Network, of course, did a lot of community building and engagement during COVID, in particular, to help build trust within that minority community, not only in the vaccination effort, but in preventive medical care. And I wanted to ask Dr. Bridgers and Dr. Rogers if you could talk in more detail about the $2.5 million in the level funding that the county executive recommended from FY23 to carry forward for FY24. What would they be able to do with that, and then what would they be able to do with any additional funding, and how does that align with the other minority health programs that we've just had summarized for us in the packet?
Yes, thank you for that question. So with the $2.5 million level funding, the BPHM program, they'll continue to be able to really promote secondary and tertiary prevention for Black residents in Montgomery County. That's particularly focused on connecting Black residents with essential community health and human service supports, as well as health and social needs to provide one-on-one support and help to navigate the system. They'll also continue to be able to connect residents with primary care, medical, as well as dental and behavioral health providers who look like them from the Black community. BPHN also does community outreach and education focused on areas which include Alzheimer's and dementia, healthy lifestyles and nutrition, senior health, sickle cell, obesity and weight management, lupus, and hypertension. AHP promotes primarily primary prevention and intervention. And so they provide services include health education, support groups, health screenings, outreach, nurse case management, focus on 6 major areas: infant mortality, HIV/AIDS, STIs, diabetes, oral health, cardiovascular disease, cancer, and mental health. So they host community events, educational workshops. So as you can see, they work in tandem across the 3 levels of public health prevention, AHP focusing on the primary, and then BPHN focusing on the secondary and tertiary prevention. So with regard to the additional $1 million, the department, well, first I'll say that DHHS, we know the county executive, he supports the BPHN's vision and mission. Dr. Bridges, myself, Dr. Davis, we all support the BPHN's programs, vision and mission, and we've been working strategically with them on kind of reimagining their program. There was a monthly call on yesterday, and I said to them, when we left the meeting, I felt spiritually and relationally uplifted and enriched after that conversation. So we are working collaboratively and in a partnership with each other. So we believe that the contract for FY24, if you all do add the additional $1 million, will support with increasing the system of integrated and aligned healthcare delivery that the department has been talking to the HHS committee about. So, which includes all of our healthcare delivery programs, the promotional efforts, and any additional money that will be added will be integrated into that approach. However, we feel that the county executive's level funding is sufficient for this purpose.
Okay, thank you. And I appreciate your insights and collaboration, and I'm really happy to hear about the call yesterday. That's good news. And I know we talked during the committee about the parameters for the program with certain aspects of it and revisiting that in HHS in the fall. So I look forward to those continued conversations. Thank you.
Thank you. Councilmember Jawando.
Thank you, and I appreciate the committee and the chair's acknowledgement. This is something that we were all very excited about at the time and didn't know exactly how it was going to take shape. But now I think we're last I've checked, we're close to 100 providers that are. I remember when we had 0 providers, and this is a big issue of having providers who culturally understand where you're coming from, understand the issues in the community. I'm proud to say my primary care doctor since I was a kid is one of these providers. People have referred. I've met several on the street that have come up and just said, this has been a great program for the community, particularly in the mental health area. And I know that as it continues to grow and change, we're going to have to figure out what the model evolves to. But I really appreciate the county executive including the initial support. I strongly think we should support the additional funding. This is a huge need. Getting African American folks to the doctor on a regular basis to provide these secondary and tertiary services, building out this network, I think it's critical to the health disparities that we're facing. Obviously, I want to be a part of, I'll join the HHS committee when we have the further discussions on the program and work with all of you to make sure it's the right fit. But we need more, not less, in this arena when you look at the disparities, particularly in the African American community. And I think this is hitting some areas that we haven't hit before. So I'm hoping we can support it and appreciate the committee's 2-1 recommendation. Thank you.
Thank you. Thank you, Mr. Jawando. Councilmember Sales.
Thank you, Mr. President, and thank you to my HHS colleagues and to our partners in these affinity groups. I was really proud to be able to introduce the proclamation recognizing Minority Health Month to raise awareness on the racial and ethnic disparities experienced by our diverse communities. And so the BPHN, Black Physicians Health Network, is meeting a critical need in our community. They are a complementary organization, I believe, to the African American Health Program, which has been really helpful in engaging the community on preventative measures. And now we actually have providers that we can point our residents to, especially with the rise in mental health challenges in the Black community. They were very proactive in attending events and providing incentives for residents to take advantage of the resources. And so I'm really glad that my colleagues on the HHS committee understood that need and raised this additional $1 million to a high priority, and encourage and hope my colleagues will join this effort to support more resources to this critically impacted segment of our population. Thank you.
Thank you very much. I appreciate this conversation and in particular Councilmember Luedtke asking for the differences in some of the networks. I've been asked and participants and providers have been asking, and so to know that we are providing support and wide and varied support to meet the needs in our community, I think, is the important bottom line here. Dr. Bridges, did you have a comment?
Thank you, Councilmember Glass. I want to commend our council members who have supported our HHS multicultural minority health initiatives over the past 3 years, and going forward, our initiatives have developed and created best practices that they are demonstrating not only within the state of Maryland but nationally, and so I salute them. I wanted to go on record in saluting them, and HHS will continue to work with all of our initiatives and their partners to continue to increase access, equity, and develop programs that meet the demand of our community. So I just wanted to state that to council and to all of those who are listening. Also to salute Dr. Chapman for her work. Dr. Rogers indicated that we have had monthly calls. So Councilmember Luedtke, we are looking at a way forward. We have a health system in place, but we understand that in the demand and need as well. So we're taking all of those variables into consideration. And so I just wanted to present that to council as well.
Very good. Want to keep going?
Sure. Okay, we are moving to the Office Aging and Disability, Service Area. So we will start with the Developmental Disability Supplement, The HHS committee recommended adding the CE recommended amount of 2% or $405,000 as high priority. The committee also recommended adding an additional 2%, which would increase the amount to $810,000, another tranche of the $405,000 as high priority. The committee also placed a one-time increase of 4.7% for 6 months at $475,000 on the reconciliation list to provide funds in advance of the state's forthcoming rate increase, and that was identified as a priority item. So just staff wanted to note that in April 2023, the governor proposed and the General Assembly supported $117 million in total funds to provide a 4% rate increase by July 2023, followed by an 8% increase in January 2024 for DDA community services as part of the statute in increasing the minimum wage.
Chair Albanos.
Thank you, Mr. President. I think, once again, received very compelling testimony from providers in this space who are struggling with their own recruitment and retention challenges, and the supplement that the county provided many years ago has been a lifeline for many of these organizations, but they have stated that it is not keeping pace with their needs, and this is an area in which the county is not able to provide these services directly, and so we rely exclusively on these remarkable organizations and the love that they show for their clients, but also their families. And what can't be measured is the peace of mind that these organizations provide to the families of these remarkable residents here in our community. So the committee did recommend an additional commitment on top of what the executive recommended for those reasons.
Okay. I don't see any comments. Ms. Brunetto, good to see you. Okay, we'll keep going.
Okay, and I will just highlight the Adult Medical Daycare Provider Supplement. The HHS committee recommended the CE, recommended approval of the CE's amount of 2% or $42,315 as high priority. For the next item, this is support for the Intellectual and Developmental Disabilities Commission that was just approved, I believe, in March or early spring of this year. The CE has recommended $36,000 and a 0.5 FTE to support this commission. This was established through Bill 1023. The committee identified this item as high priority. Okay, and for the Medicaid long-term care programs under A&D, the HHS committee recommended approval of the CE's recommendation of $1.2 million and 16 FTEs to support the Medicaid long-term care programs. This is the Autism Waiver Program, Adult Evaluation and Review Services, and Community First Choice. The staff bill for their services, so the staffing budget requested is offset by expected revenues. This was identified as high priority. So this increase is attributed to the In the Wait Act, requiring the MDH to create and execute a waitlist reduction plan for each of the waiver programs by 50%. And that's the end of the aging and disability section.
Okay. No comments from any of us, and Ms. Yao is joining us.
So moving on to behavioral health and crisis services. For fiscal year 24, the executive is recommending $53,176,954, which is an increase of about $2.3 million or 4.6% from the fiscal year 23 level. The recommended operating budget includes 250.35 FTEs, a proposed increase of 14.5 FTEs. The HHS committee is recommending one addition to the reconciliation list, and it is to restore funding that is recommended by the county executive as a reduction. And it's $110,549 to restore reductions proposed by the executive to the substance use disorder residential rehabilitation service contracts with Cornerstone Montgomery Family Services, Inc. and Rock Creek Foundation. The committee recommended this as a high priority. The reduction would negatively impact the delivery of critically needed services offered by these organizations, and the item has been raised as potential savings in the past in previous budgets, and the council has rejected each previous proposed reduction.
Councilmember Stewart.
Couldn't type fast enough today. So
We will be switching to the new system after the budget.
I'm sorry.
Is that by design?
Yeah, so I did have a question on this. So I wanted to make sure I understood that the committee is recommending as a high priority the reduction.
No, it's recommending as a high priority restoration of the funding, so it's on the reconciliation.
I'm just wanting to make sure. All right, thank you.
Good question. No other comments.
Okay. Okay, then moving on to Children, Youth, and Family Services. Council staff just wanted to highlight that there was a correction to this packet that was sent out to council members yesterday. I do have additional copies of those pages in case anyone needs them here. But moving on, for fiscal year 24, the executive is recommending an increase of $4.2 million or 4.6% from the fiscal year 23 level. That includes an increase of 8.04 FTEs to a total of 618.57 FTEs. The HHS committee recommended placing $673,699 on the reconciliation list as a high priority to continue programming previously funded through the Youth Harm Reduction Initiative. This came over as a budget amendment from the CE. In addition, the committee had understood that there was $180,000 that was originally proposed for consultation services in fiscal year 24, but subsequently we learned that those services will be obligated in fiscal year 23, and as a result, $180,000 in fiscal year 24 will not be needed for those consultation services. However, the committee recommended keeping the $180,000, putting it on the reconciliation list as a priority to further provide expanded capacity for additional services for the Youth Harm Reduction Initiative.
Council Chair Albernas.
Thank you. So we've got a great update from Ms. Treadvance, Mr. Luis Cardona, and the entire team on the youth harm prevention. And this actually came up within the context of the Economic Development Committee. And I mentioned it then because this does cross over in that we are trying to provide services to youth who have experienced huge challenges, as we are all are acutely aware, during the pandemic. And so this will continue the programs that had been funded and have been initiated in FY23, but took a little longer in some cases than any of us wanted to. But the good news is they are up and running, and those services are going to be critical, particularly going into this summer, which is typically when we see the rise in youth harm, youth crime. And so the hope is that we head off at least some of that at the pass. And we've got great providers who are doing good work in this space.
Thank you, Mr. Chair. Councilmember Jawanda.
Yeah, just wanted to mention we obviously the partnership here with the ENC and HHS committee and how important what the chair of HHS just said. A few years ago we made a massive investment in summer programming, and now I think obviously now is just as important. And so I want to thank Ms. Treadvance and her team that she oversees and all the many providers. And so, as is mentioned in the packet, we reviewed a lot of these programs together, and I just want to underscore the importance of them. So, thank you.
Thank you.
So that's the end of Children, Youth, and Families, except for, as Councilmember Jawando noted, there are a number of items within Children, Youth, and Families that were reviewed by the joint HHS and ENC committee, and we'll be getting to that later on.
Thank you.
Okay, next we will move to the public health service area. I just want to note again the charts that it might be easy, just a way to just see the flow of things that are in the service area. So I'll just highlight the vacancy reduction that was recommended by the committee of a 0.5 community service aide, amount of $53,000. This was identified as high priority, and this position had been vacant for over 5 years. I will transition past the COVID response readiness, as that was already discussed, and the food staples programs. And so we will go to...
Oh,
It's coming.
Huh?
Go ahead.
It's coming. Keep going.
We discussed, we jumped ahead and discussed and adopted the committee chair's recommendation. But now we're getting to the meat of the issue, and we are. So you want to pick it back up so that we could...
So the next item is actually the mobile health clinic.
Okay.
And so...
Another hot topic, yes.
We did just want to provide a little bit of context on the mobile health clinic.
If you could just text me, I'll let him know. I'll let him know.
The next item is the mobile health clinic. As was noted, we did have some fluctuations in the information that we were able to resolve with the department, and so there was some back and forth discussion. I think what we can summarize at this moment is that the mobile health clinic was initially funded under ARPA funding. There were, as we experienced in any number of areas, a significant number of delays in implementing that, and as a result, it has not yet to date, I should say, not never, it has not yet to date reached full implementation. DHHS has let us know that they are actively hiring. There are positions associated with it, and that the vehicle that will allow it to be mobile is on its way, probably this fall. So that was, again, some of the back and forth around the timing, was some of the back and forth that we had in committee regarding how that funding should be identified. Ultimately, I think given it is reflected on the reconciliation list as a priority, it is, however, also underway and in progress.
Thank you. Councilmember Balcom.
Thank you. I just, before I start, want to thank Dr. Bridgers for all the work that you do, and also for council staff and Chair Albornoz, particularly in the last couple days in going through this. and I do want to apologize for snapping earlier. I'm terribly frustrated by this, and I'm going to try to channel my inner Natalie here. And so buckle up. So I have to, our rural community is vastly underserved when it comes to healthcare. Part of it is geographic. Many parts of the Western County are 15 miles or more to the nearest doctor or dentist. And most people don't know this, but so it's not only geographic, but it's income related. Many of our low income residents in the western upper Montgomery County lack access. They're large migrant farming communities that just don't have the means. And in a study, 2019, pre-COVID, and I can't imagine that it got any better, looked at, it was a zip code ranking of all the zip codes in the county, and the Poolesville zip code, which covers a significant part of that ag reserve, ranked last, 36 out of 36 in the county for multiple health incomes, including overall lifespan. So this is a critical issue that has not been addressed. In Montgomery County, the average is one doctor for every 700 people in Montgomery County. In that zip code, it's one doctor for every 7,000 residents. Only one eye doctor, one dentist. So this is real, and we've just talked about all the vulnerable populations that we're providing funding to, and we are ignoring this population. So in the past year or so, the Fair Access Committee, everybody knows the Fair Access Committee, they've been very important and very strong, have had conversations with the county executive, with HHS, with the health officer. Everyone has agreed and promised the Poolesville community that we would get funding for access to health care and dental care. Dental care is critical here. That did not happen. The county executive's budget did not include any additional funding for this area. And again, as for the funding that we just looked at for Office of Community Affairs, if any of those resources are going to this up-county rural community, they are not coordinating with the one local nonprofit provider. So if it's happening, they're not coordinating with the local people. So back to the mobile clinic, right? So my staff, bless them, have been, trying to find the money, right? And in trying to find this money that's supposed to be for Poolesville, we found this van, right? The van that's supposed to be operational, and it's been very confusing, and I admit I'm frustrated by this. Come to find out, there's supposed to be a van. It's supposed to provide some level of service to Poolesville. We're not sure. There's no guarantee that it will provide services in Poolesville. But staff are already being hired through ARPA funds. Very early on in the packet, we note that the ARPA funds are moving over, yet in the committee recommendation, it's not moving forward. So I don't know what's going to happen to these positions. I don't know what's going to happen to the people. I don't know what's going to happen to the van. Are we going to wait till 2025 to put this van into operation? But most importantly, what is going to happen to the people in the rural county, the rural part of Montgomery County who are not being served? And so at this point in time, I don't even know if we need to move forward on the $711,891,000 to get this mobile health clinic. If it's not moving, what's going to happen to the people? If it is moving forward, then we need the money to move forward. So I'm just so frustrated by, and we have been trying to get this sorted in the past 3 months to make sure that this very vulnerable community is served. Thank you.
Thank you, Councilmember Balcom. Councilmember Stewart, I'm sorry.
I didn't know if there was a response to that at first. Thank you, Councilmember Balcom, for that. And what I was going to ask was, will the mobile health clinic, if it moves forward, also provide dental services? No. No? Yeah.
So thank you for that question. And first, thank you, Councilman Balcom, for those comments. And we echo those words. And I know for me, since I have learned about the disparities in Poolesville, I have taken a commitment to making sure that I do my part and securing HHS's resources to provide access to that community. Not because I always drive through there going home and I love to look at the nice landscape, but you know, this is part of my life's work, and wherever the need is, I want to make sure that I do my part in facilitating that. And I know I speak for the entire HHS and working with the Poolesville community in order to do that. Also, just to clarify one important piece for the record, which is 4 of the 5 staff are on board. It's a new program, and so we have to plan it accordingly with evidence-based practices, making sure we're able to collect data, making sure we're able to keep patient data confidential. So all those things and standing up a new healthcare clinic is really what we are undertaking. We have been undertaking since the staff joined at the end of February. The position that is still being recruited for is a nurse practitioner, which, like the overall healthcare industry, is having challenges with identifying nursing staff. However, as we spoke about a few weeks ago, the department is in communication with 2 local universities that have family nurse practitioner programs to see if we can strike some type of partnership and collaboration with them through a contractual arrangement for a family nurse practitioner. So we remain hopeful that we will be able to execute those contracts rather quickly so that we can fill that nurse practitioner position. To your point, the mobile health clinic will offer integrated medical, dental, and behavioral health services. And additionally to that, and we've said it on record, we have committed to having a monthly presence in the Poolesville community. As long as I'm in this seat, as long as Dr. Bridges is my boss, we're going to be in Poolesville at least monthly providing these services. We also have committed to providing monthly services in the Silver Spring Hewitt Avenue district. So those are the 2 communities at this point that we have committed to having a monthly presence in as we use a pop-up modified model. And once we get the vehicle on board, the pop-up modified model, we hope to be able to launch those by the end of the summer. We'll be able to offer the services just in a modified capacity. For example, if you may need more extensive dental work, we need to get you connected to a local dental clinic because we might go and do an extraction or teeth cleaning on site. And so we'll be working with community partners to identify physical space where we can put our equipment, like in the county van, bring it on site and conduct medical, dental, and behavioral health services.
Great. So I'll yield back to Councilmember Balcom, but I would actually like to move to have this pushed up to a high priority.
Thank you. So I was just going to ask the question, if we don't move this money forward, the people were hired through ARPA, right? There's no funding going forward for the people that were hired from the ARPA funding. Is that true?
Yes, this is the, Jason Rangel, Acting Chief Operating Officer, HHS. This funding is replacing the ARPA funding. So yes, if this $711,000 was not funded, those positions would not be funded anymore.
Thank you. So I just wanted to clarify that. And then the other point about the dental, so thank you. That was another confusing part, is whether dental was included in here. And thank you for raising the issue of significant dental, because we are in such a backlog for dental health. in this area that it's not a simple cleaning and it's not a simple extraction. We've got very serious dental needs, so I appreciate that. And thank you for, and I fully support, we have to move this funding forward. Thank you.
So there's a motion by, real quick, so there's a motion by Councilmember Stewart to make this a high priority area, and Councilmember Sales, but Councilmember Balcom also extends her enthusiastic support for that. Yes.
I would like to clarify that point because it was not council staff's understanding that dental was included in the level of funding that the executive had put forward. So I just want to be very clear on that point, whether the $700,000 does indeed provide dental services or what exactly is included in that level.
Yes, thank you for that question. The $700,000 covers the 5 existing staff, nurse practitioner, licensed clinical social worker, 2 community health workers, and 1 driver clerk, and then some additional operating dollars for clinical supplies. For the dental piece, we will leverage existing resources within our county dental program in order to provide those services on board. We are outfitting the vehicle to offer dental as well as medical services, so both operatories will be able to utilize to provide medical or dental services.
So I just thank you, and I think that is an important clarification that the van will provide additional transport to bring the services, but certainly I do just want to emphasize that the capacity in our existing dental program has been an issue.
Thank you. Councilmember Sales.
Yes, thank you, Mr. President, and thank you, Dr. Rogers. We met a few weeks ago with Dr. Davis and members of the Poolsville community to talk about the increase and desperate need of health services because of the lack of infrastructure up county. And so I'm really excited about this initiative that's going to build upon the local health clinic that they have and also go even deeper into the rural communities to go into some of the farms that have people living in the shadows of some of these communities who don't feel comfortable seeking out health care. So this will provide an opportunity for the county to go to the residents that need these resources the most, and I'm glad that my colleagues see the importance of the up-county community.
Thank you. Turn it over to Mr. Chair Albornoz.
Thanks. That's why this process works, because when we get back to full council, we get information in real time that's often helpful and we don't hear about in committee because everybody's just so busy and stretched. So a couple new things that the committee had not discussed, and it was not represented that the van was going to be going to Poolsville, which we acknowledged and have discussed in committee before, the need to be able to focus on for all the reasons that Councilmember Balcom enunciated so eloquently and so passionately. That was really great, Councilmember Balcom, because it is very important. We're all obviously in the same place. The other issue was when the actual van would be ready for delivery, because there were understandable concerns raised. As was noted, anybody who tried to buy a new car in the last 2 years knows how long it has taken to actually purchase a vehicle, and specialized vehicles such as this have taken even longer. But if we're hearing from our colleagues in public health that they're moving more quickly, that's great news. And so I am fine and concur with the motion on the floor to move this to high priority. And we also, we'll revisit this, Councilmember Balcom. We'd love to work with you and your team so that we have a session exclusively focused on providing health services to our rural areas, in particular Poolsville, because this van alone, as great as it is, still won't meet all the need that's out there. And so we're going to have to do more. But I concur with her recommendation to move this to high priority, given the information we just received.
Thank you. Councilmember Katz.
Thank you very much, Mr. President. First off, let me too thank Councilmember Balcom for once again reminding us of the very serious concern that we have, and it really is the greater Poolsville area. It's not just the Poolsville area, but it's beyond. It's some very important issues that we are not addressing the way they should be addressed. And I also believe that we should involve again or discuss with their partners in the town of Poolsville. So this is the greater Poolsville area. They certainly are people that would want to be helpful and with us. But I also think we need to figure out, while we're waiting for the van, and it's, you know, that will be some help. I don't know that once a month is enough help during a time when someone is having a health crisis. But, you know, we literally have to take one step at a time. But I think we need to have a serious conversation, whether it's in this budget or how we're going to do it, on transportation needs for someone in that upper area that is having a health issue, who might not be able to have transportation on their own, how we're going to get them that 15 miles or whatever it is to an area where there are more physicians and dentists. So I think we can do that sooner rather than later, and I think we need, and I know you want to work with us to do that. When someone is having a health crisis, it's not just their crisis, it's our crisis. So we need to work with you. Thank you.
Thank you. Vice President Friedson.
Well, thank you. Amen to everything that Councilmember Balcom said. You know, I represented this community for 4 years, and everything that Councilmember Balcom said, all the frustration that she channeled is real for the people who live in this community. The health outcomes are real for the families and for the people who live there. And it's an aging community. Most of the health challenges, and one of the issues that we have, is that the school population is younger, and those families tend to be healthier. And much of our outreach to families is through schools, which there are very good reasons for that. In most communities that works, and that makes sense. But the acute challenges in the Up County, and particularly in the greater Poolesville area, are disproportionately with vulnerable aging adults who don't have school-age children, who have limited ties directly to the school-age population. And so our system and the way in which we calculate needs and the decisions that we make accordingly don't work for this community and haven't worked for this community. And the outcomes as a result of that have been devastating. And I am glad that we are beginning to right the ship on this, understanding that when we make policy decisions, those policy decisions have consequences. We've intentionally said we don't want there to be density in this part of the community. And so then if we make calculations based on the amount of density that there are in particular areas, we're going to be leaving these folks behind. And so we do, you know, if we're talking about equity issues, then some of it has to be to fully understand the total consequences of some of the decisions that we make. And so I really hope that the conversation that we're having here, which has been an incredibly important conversation, that we broaden out that thought process to all the various issues that are related to this. It's not just about a mobile health clinic. This will help. This is a start, but once a month isn't enough. And you heard the statement about 1 in 700 versus 1 in 7,000. That is a dramatic difference. And the 1 in 7,000, if you don't have somebody who's 1 in 7,000, the distance to get to somebody is exponentially greater. And if you're somebody who doesn't drive, who can't afford a car, who has impairments and physical challenges, you're out of luck. And what has been happening up to this point is, by the grace of this wonderful community, retired volunteers have been individually driving people to their appointments for years. And that is just not a system that is going to keep enough people healthy and enough people safe and, frankly, enough people alive. And so I wanted to highlight that and note that and bring it back to that. I appreciate Councilmember Katz noting the transportation. That is a huge issue. You know, we need to bring the services to the people, and this mobile unit will be a part of that solution. But we also got to figure out a way to get people to specialists and get people to appointments. And that has been an ongoing challenge. I have not been able to solve it. I yield to my terrific and talented and passionate an effective colleague here who is now ably representing that community in dire hope that she will do a better job of solving it than I have been able to do up to this point, because we need to solve it, because it is a huge challenge, and it has to be part of this broader discussion about access to services. We have to bring them to the community, but we have to make sure that we bring those who need special help, particular help, specialist support with medical care to the places where they need it. And I hope in the meantime, as we figure out this mobile unit and we figure out how it's all going to work, that we think creatively about pop-ups, and we think about how we can do more than once a month, because there's more need than that. And we really think through the partnership with the community, because there hasn't been enough of a connection with WUMCO. There hasn't been enough of a connection with the community. If we learned anything during COVID, not just in this community, but in all communities, the path to addressing the needs, to making sure that the holes in the social safety net are not so big that so many people get through, is to make sure that we're layering partnerships with community partners, with nonprofit community partners who actually know where the folks are who need the help and how to get there to them. So I implore you, I know you're committed to this, I appreciate your interest in this, but I implore you to really partner with the nonprofit community that is out there, with the community and political leadership that is out there. They know what the needs are, they know what their community needs, and they just need the county to help.
Thank you.
Thank you.
Dr. Bridgers.
Thank you, Council President Glass, and thank you, Council Members Balcom and Friedson, for your insight and input. But we are thinking outside the box. I wanted to share with you a couple of strategic initiatives that the county executive has charged me with in my acting stead as the director of the Department of Health and Human Services to expand access to care. The mobile unit solely won't get us there. We are looking at Mr. Hodges here. I've asked him to build upon the lessons learned and to leverage the community level engagement through our hub and spoke model. We want to go deeper in the community. We want to have wraparound services provided in the community. We know that access and equity are challenges, and we continue to seek methods to increase access, whether it be through any medium. The other notion that Dr. Rogers, and he can expand on this because I've charged him with this initiative, is to expand our Montgomery Cares providers. Up-county providers such as Proyecto Salud and Care for Your Health, trusted entities in the community. And we want to engage our trusted entities in the community to help increase that access. And so we're working very diligently behind the scene to push those initiatives forward. So while the budget session is bringing forward some of those challenges, we will return because it does cost. And we're looking at sustainable efforts in working with our providers because they do great work in the community, and we saw this, as Councilmember Friedson indicated, during COVID. And so we've packaged all of those lessons learned to make a better level of community engagement. Dr. Rogers, if you want to add anything to the network adequacy study that we've done and what we're doing, hopefully in the new fiscal year, to bring more providers, community providers. We talk about the Black Physicians Health Network, and we talked about servicing them and supporting them and increasing their reach as well. So,
yes, thank you. I'll add two things. One is the county is contracting with NORC out of the University of Chicago to conduct, I think, the first ever extensive network evaluation study of our Montgomery Cares to ensure that we are meeting the needs, desires, and preferences of our residents who are participating in Montgomery Cares and who have participated in Montgomery Cares, but we may have lost to follow up. Also making sure that we are maximizing the capacity of existing providers, and where the evaluation identifies gaps, we want to go back to existing providers to see how they can fill those gaps and then reach out to additional providers such as the Black Physician Health Network providers to bring them into the Montgomery Cares program so that we can expand access, expand capacity to places where we are not currently reaching. And so the county will have those, the department will have those results later in the fall, and we'll be sure to share those results with county council. I'll also mention a second thing, which is transportation. As you all know, OLO conducting a report, Transportation Barriers to Medical Appointments. There were several recommendations in that report for the executive branch. Probably about two of the three or so recommendations came over to HHS. And so on behalf of HHS, I have been leading that initiative to address those recommendations that OLO has put forward for the executive branch. One of the recommendations calls for innovative and effective strategies to address transportation barriers to medical appointments. We have convened a work group, and our fair access link is on the work group. We have about a dozen or more community stakeholders that are part of that work group that are contributing recommendations on how to address transportation barriers to medical appointments. I'm working with ACO Jake Wiseman, so we will issue that report to the CAO, and we'll make sure that County Council also receives that report, because there will be a set of concrete recommendations that the executive branch as well as council can take in order to address transportation barriers to medical appointments.
Thank you. Councilmember Stewart.
Great, thank you. I wanted to follow up again on the dental services, and I know we get to that later on as well, and switching the county dental services, and that was a high priority, moving them from contract to merit staff. And I don't know, and I really appreciate the HHS committee, and this is a mammoth budget with so many pieces and essential services for our residents. But I did want to go back to the conversation before about what is currently underfunded in our dental services, and as we are talking about the budget now, you know, making sure if there is a need, if we're doing this mobile unit that will be outfitted for dental services, and we are, or at least it's on the list, to switch some folks from contract to merit to build our staff in this area, is that adequate for the moment?
Those staff transition are unrelated to the mobile health clinic.
Right,
They are
okay.
staffed out. There are 5 county dental locations that serve around 6,000 people a year. So those staff will be at the county dental physical sites. The department, I think, can elaborate more about.
Yes, these are, I believe, existing budgeted staff for contracts. Is that right, Jason? And what we're planning to do is transition those staff from contractors to merit staff. That gives us a couple of advantages. One, clinicians love county benefits, and so.
No, sorry, I know we'll get to that in a moment. I don't mean to cut you off, but I'm trying to get my head around whether or not there is enough funding to do dental services with this mobile unit. I understand it will be outfitted for it, but are there additional funds that will be needed to do dental services for this?
I think, to speak to right now, there's not dedicated funding for dental services in the mobile health van. We'll be using existing resources. I think the idea is to evaluate what resources are needed and look at it, and then either come back in the next fiscal year or with the supplemental if there's additional resources needed based on the use and based on once we get it up and running and everything. So I think the goal is for the time being to use existing resources, sort of pulling them from other places, which is not ideal, but I think it gets us, when we're starting off a program, it's a way to do it, to sort of identify how much the need is and what's the best way of going forward. And so I think that's the plan for this year.
Okay. All right, as we're reviewing this, you still have a few more days. I'd ask the chair of the committee if there is something you would like to bring back to us before we finalize. This is, as Councilmember Balcom talked about, and I know the mobile unit will be hopefully in Silver Spring as well. The dental access is huge. So wanted to put that out there. And for the record, could we have the Councilmember Balcom move this to high priority, and Councilmember Lorianne Sales seconded? Thank you.
Thank you.
Without objection, Councilmember Sales.
Thank you, Councilmember Stewart. So I just wanted to clarify, maybe you can help, Dr. Rogers. I thought the American Diversity Group, which was at the last Poolsville Town Fair, they're pivoting their services and actually providing dental services, is my understanding, and they've partnered with Fair Access and WUMCO. No?
They're finished. They're not doing anything.
Are they not doing that anymore? That's why.
So in FY23, we did identify some mobile health ARPA funds to provide to American Diversity Group to then subcontract or contract with WUMCO, Care for Your Health, and Casa Rubin in order to provide dental, medical, as well as access to specialty care services, care coordination, and case management and medications. That will end at the end of FY23. I'm looking at Jason. And so, yes, those services will end.
Okay, and can you tell me what some of the recommendations were following the meeting with the Fair Access Committee and Dr. Davis?
So, it's a good question. You kind of put me on the spot there. Yeah, I mean, I think that the recommendations are consistent with kind of what we have been emphasizing here, is what is ensuring that there continues to be an investment in dental services as well as medical specialty medications, as well as resources to address some of the social determinants of health. The case management and care coordination that comes along with being able to link individuals to care and provide them with the wraparound supports as far as follow-up, reaching some of those far places within Poolsville where many of the migrants live. And so that was a big emphasis of the conversation, which is some people who are living on the farms or on kind of the back roads in Poolsville may not come to the I guess the inner city parts of Poolsville. So how do we take resources there? For example, utilize the community health workers we talked about as an opportunity to deploy them in some of those communities. We had very robust conversation about how different ways to begin to address that. And, you know, the department believes that, yes, I mean, it's clear the mobile health clinic is a way for us to begin to get ahead of this issue. But as you all have noted, continued investment in additional resources, leveraging existing programs like Dr. Bridges mentioned, expanding our access to Montgomery Cares providers who are willing to go into that community. All that plays a part in ensuring that we increase access to care in that agricultural reserves community.
Okay, and I know that with the Health and Wellness Center that's coming, that's going to be an additional resource for the community as well, for them to take advantage of public health services in the community as well.
Yes, we did talk about that. Thank you.
So I would just say that a school-based health and wellness center at Poolsville High School is an item that will be continued to be discussed in terms of what level of services are ultimately built there. But the issue with school-based centers is that they can't be widely open to the public because of the nature of the school. Right. So not the broader health community.
Yes, no, I understand. But in the meantime, they did get funding for a trailer to start preliminary services. Okay.
Okay, final word on this, because we have a lot more in this budget to get through. It will go to Chair Albornoz.
Yeah, I'll be very brief. To Councilmember Stewart's point, yes, we are totally committed to expanding and making sure there's a strong infrastructure and public health for dental services. We all received some incredibly helpful testimony from our friends in Action in Montgomery who have moved forward a recommendation for an initiative. Dr. Rogers has met with those representatives, and although there wasn't anything ready in this budget for prime time, this will be very much a focus. And once we have the pieces in place that Dr. Rogers has articulated, we will be revisiting this very shortly after this budget is passed. Because there is a recognition for a need to expand services immediately, because this is a critical area. I'll just note in conclusion that There are providers that have really stepped up in this space. The Mary Center is one example of that. We need more of that for sure. We also need a more holistic view in how we're providing these dental services, so more to come.
Thank you. Really important conversation, and we have a motion on the floor made by Councilmember Balcom and seconded by Councilmember Sales. Thank you, Councilmember Stewart, for moving this mobile health clinic from the priority to high priority. All those in favor? That is unanimous by all those present. Okay, keep going.
Thank you. Next is the Charles Corner Conservancy. Oh gosh, say that 5 times fast. For urban farming, the HHS committee recommends approval of the CE's recommendation of $50,000 to support a community-led urban farm in Wheaton. That's high priority.
Councilmember Fanny Gonzalez.
I am so excited about this. I've been working with this community, with Hannah and with Kate Medina for leading this nonprofit and finding a spot in Wheaton for urban farming. This is one of the 2 that I'm actually working on. I won't mention the second one, but hopefully it's going to happen, and stay tuned. But yeah, thank you for working on this and for the county executives team to support this. That's all.
I'll just add to this. Over the last number of years, I've been working with community organizations on finding county property that had gone unused. And in the Wheaton area in particular, I'd worked with Identity to identify Department of Transportation property that was vacant. And so they ended up turning that into an urban farm. So I think there's a lot more collaboration and innovation that can take place. So I think this is a great idea.
Thank you. Next item is Manna Food Center. The HHS committee recommend restoring the executive's reduction.
Could we just skip this one, please?
I will make one note. So it is to restore $300,000. This is a partial restoration because the total amount wasn't reduced. The amount approved in FY23, I believe, was like around $500,000. So this was a partial reduction. There is recommended that this be restoring the recommendation of $300,000 to priority.
Councilmember Tawando.
Thank you very much. And, you know, obviously a lot here, a lot in the budget, but the work that's being done by MANA in coordination and partnership with our hubs, and particularly in East County, but across the county. And I appreciate you mentioning that this was a less of a restoral than what was last year. You know, my suggestion would be to move 150,000 of this to high priority, realizing the constraints on our budget, and leave the other 150 in priority. It's just to try to get something there, knowing it's still going to be difficult and there's a lot of needs. So that would be my motion.
I'll second.
Moved by Councilmember Tawanda, seconded by Councilmember Mink. Comments?
Yeah, MANA has done such fantastic work for our community, and acknowledging that we certainly have budget constraints that we're working in. Also, that this is money that I think is very well spent. I know for the folks in my district, MANA is a resource that they turn to quite a bit. It's essential, and they have really demonstrated that they are going to do well with the funds that we give them. So I appreciate the motion, and turn it back to colleagues.
Thank you. Councilmember Lutke.
Thank you, Mr. President. I wanted to be noted as voting yes when I stepped out to go to the ladies' room. But I just had a question because when we discussed this at committee, and the question was sort of the why it had been taken out, and there seemed to be some misunderstanding about the renegotiated contract with MANA from the fall of 2022. And I was just wondering if there was any clarification that you all were able to get about why it was the way it was, right? Because I haven't seen the contract. I don't know what it says. MANA does amazing work, very vital work, but it seemed like it might have been directed at a specific personnel issue and not part of the overall provision of food portion of their work. So could you clarify that?
I will try to. I think There was some maybe confusion in the supplement, the additional money that was added last year by council for MANA above the budget. It was thought to be infrastructure building, which was taken to be one time only. I think MANA's use of it has been more building infrastructure through personnel, to be fair, and so that they would believe that continuing it would be necessary for what they're doing. So they're, whatever the amount is, we'll work with MANA to revise the budget and to have a sustainable budget for next year with the amount, however it is provided in there.
Thank you. I appreciate the clarification. Thank you.
Thank you. Chair Albornoz.
Again, another good example of just new information in real time, and I appreciate the subsequent conversations we had with Jackie and her team after the committee had made its recommendation. I concur with Councilmember Jawando's recommendation. This is a structural issue that we've got to fix moving forward because we need MANA to continue to be able to do its work. But this is, I'll just say it one time again, another example. There are many other organizations who are in similar situations, and so that's why I think the 2% would help some others who are in similar situations. But I concur with the recommendation to move this to high priority.
As do I. We all know the incredible work that MANA has done and will continue to do. So there's a motion. All those in favor of moving MANA food from priority to high priority, and that is unanimous.
Okay. The next item is staff support for the TB program of 44. Oh my gosh, I can't speak today. $44,742, adding 1 FTE to support the monitoring program. Okay. Move to the next item. This is for the Environmental Health Plan Review Specialist. The HHS committee recommended approval of the CE's recommendation of $62,000, adding 1 FTE to support inspections and reviews. This was identified as a high priority item. Okay. We'll go to Nourishing Bethesda. The HHS committee recommended approval of the CE's recommendation of $24,000 in one-time funding to support their longer weekly operational hours and enhanced food distribution. This was identified as high priority. Okay. The healthcare for the uninsured programs. So the first item, this was an add by the committee, is to support the Care for Kids program with an additional $100,682 to the high priority list to increase the funding for medical providers. This will assist with the current workload and preparing for the new migrant and asylum seeking children that they see through the program. This was an add identified by the committee as high priority.
Very good. Know that we had a lot of conversation about dental needs before, so I think that those statements will stand on their own.
And so I'll go through the Montgomery Cares program. The CE recommended adding $2 million to increase funding for primary care via visit reimbursement. This will change the reimbursement rate from $76.50 to $102.15, still funded at the same number of encounters as they are currently. The committee also recommended approval of the CE's recommended amount of $30,000 for the behavioral health portion of Montgomery Cares due to an increase in the amount of the psychiatric consultation services. This was identified as high priority by the committee. And for the last for county dental services, part of healthcare fund the uninsured, there was a recommendation to add $181,000 to the rec list, shifting 9 FTEs from contract to merit. This consists of dental hygienists and dental assistants working at our 5 clinic locations. This was identified by the committee as high priority.
And that's what I was referencing 30 seconds ago. Yes.
And we just also, we'll move on to, so the next area is shifting to the different service areas, to services to end and prevent homelessness. We have our letter stuff showing us.
No,
okay,
see Ms.
so,
Miranda coming up. That's great.
Yeah, we will start with the overflow sheltering. The CE recommended and the HHS committee approved $1.5 million in one-time funding to provide overflow sheltering as high priority. There was a recommendation that the other portion, the other portion of the 1.5 be identified as priority for overflow. for COVID-19 sheltering. Oh, we won't go through this piece. This was identified as we talked earlier. And then, so the only two pieces for the committee to consider would be the overflow sheltering and security funding, which was a CE recommendation of $388,000 for security services at Interfaith. The HHS committee identified this as high priority. Yes.
Let's go through Seth. Oh, you just did. We just concluded there.
Just the shelter services.
Yeah, just the shelter services. Councilmember Mink.
Thank you. Yeah, I wanted to talk about this one because I just have concerns about whether we're going to have enough shelter facilities with the cut to the overflow sheltering. Noting that we've just gotten the data, which has already been referenced, about the increase in the unhoused community, and we have been. I know we've certainly been hearing from our partners and our providers about the increasing needs that they have been feeling. I know that I've been hearing from constituents who are having trouble getting access to emergency shelters. So I just wanted to, if we could hear from the committee a little more about that, as well as from Dr. Bridgers, or whatever thoughts you all may have.
I don't know if Chair Albornoz wants to weigh in, or we can go to Ms. Branda.
I'm going to yield to Ms. Branda, and then I'll chime in after she speaks.
Yeah. I just want to note that this conversation is concentrating on the overflow sheltering. The COVID sheltering was part of the COVID discussion.
Thank you.
So our overflow sheltering, just to put in context, is used generally used for households with minor children where we don't have capacity in our more permanent shelters. And so that's why we do designate it as the overflow. At the beginning of COVID, we made the decision that we wanted to bring as many people inside as we could, and we would not turn anyone away. And we substantially increased our use of overflow sheltering. So we have always had a base budget allotment for overflow sheltering, and we have been using the FEMA non-congregate sheltering funds to help supplement that, to ensure that we were providing additional sheltering. And so this request accounts for what we anticipate being that somewhat of a new balance between supporting people in maintaining or transitioning to our shelter facilities. This would just be that overflow. And so we use the overflow for families. It's sometimes short term, just like, let's confirm that there isn't another housing option, that you really do need to enter the homeless system. And then as soon as there is space available in one of our shelters, we have Dwelling Place, Stepping Stones, and National Center for Children, Youth, and Family provide family sheltering for us. And so they'll transition there. Or sometimes we do have adult-only households that are in our overflow sheltering, where there is maybe an extenuating medical need that cannot be accommodated in our main sheltering system. As has been noted or alluded to, our PIT numbers did come out, and we did see a 53% increase from 2022 to 2023. And that is why we are in part requesting these additional funds, because we know the need is there to continue to have access to that overflow shelter.
And when you say that the funds needed to meet the demand or the anticipated demand, you're talking about the both tranches there?
Yes.
Okay. Any thoughts from the committee about why you decided to split the high priority? Your thoughts now, given the data that came out from the PIT count?
Yeah, I think the information through the count is new.
Right.
And so, I think if we need to move both to high priority, that's fine. I'll also note that this is one of those areas where the executive branch does regularly send over supplemental appropriations that we turn around quickly based on needs that arise. And that's what we did all during COVID, as necessary. But if what Ms. Branda is recommending now is based on the new count, then I think that both should be included.
All right, thank you. I appreciate that. Well, given that, then I will make a motion to move the second tranche to high priority.
Okay.
I'll second.
So Councilmember Mink motions to move the second tranche of funding from priority to high priority, and that's seconded by Councilmember Sales. Councilmember Sales?
Well, I was going to ask the same question, if we could have had more information about what was spent this past year in light of the new information that's been received, if this would be necessary. So thank you for answering. Thank you for asking.
I'll just weigh in and extend my appreciation to Ms. Branda and the entire team, and look forward to working with your new director when Ms. Hong comes on board in the next few weeks.
Monday.
The next few days. There we go. Time is crunched. And so, both of you know the relationship with our nonprofit providers, and a number of us just last night were celebrating the good work of MCCH on the same day that the news came out for the DC region that our unhoused population has increased. And so I appreciate and will support this motion, and know that we have to continue doing more work in this space. So there is a motion. All those in favor of moving from priority to high priority for that second tranche, that's unanimous. Turn it back to you, Ms. Clemens-Johnson.
Okay. So next we will go through the joint committee recommendations, particularly on the HIF and SAF. The county executive recommended an increase for the Housing Initiative Program of $1.7 million to keep up with rental increases. This funding will allow the program to continue to serve 500 households. The committee may identify this as high priority. This same thing for the Permanent Supportive Housing Program. There was a recommended increase of $300,000 to continue to serve 160 households. This was identified as high priority. For the Eviction Prevention Program, the CE has recommended $1.7 million in the DHHS budget, shifting from ARPA funding to county general funding. The committee placed this on the list as high priority. And then there was also extensive discussion on the ERAP program, funded at $14 million within the CEF budget under the Rental Assistance Program. This is a rollover of the FY23 ARPA funding, and the program closed to new applications in January. The committee strongly expressed that the COVID rent relief program should be prioritized to open once DHS resolves the program requirements and other particulars that they were sorting through.
Okay, so now we're moving on to the joint HHS ENC committee recommendations. The joint committee reviewed and recommended approval of the executive's proposed fiscal year 24 operating budget funding for the following programs and initiatives: early childhood services, child care subsidies, Head Start, linkages to learning, school health services, high school wellness centers, high school cluster projects, and the early care and education NDA. Ms. Clemens-Johnson will brief you on the newcomers initiative.
Yes, hello. So the Newcomers Initiative, the CE recommended $6.4 million and 14 FTEs to support the program. The committee identified this as high priority. The Benevitos Initiative has been supported through one-time funding since FY22. The total funding in last year was $6 million flat. So the new funding of around $400,000 will support enhanced case management, mental health services, street outreach, and expanded hours at school-based and school-based wellness centers. So I did want to highlight the work that was going on with SAMU and helping the migrants that were bused into DC. That work is still going on. It is not funded out of this budget. SAMU receives funding from FEMA, and Montgomery County maintains a agreement with SAMU for them to use a county facility for respite. So I will end there.
Very good. Chair Albornoz.
Thanks. I'll just note how proud I am of this initiative, and I know all of my colleagues support it, and why it's so important. We've been all reading the national news with the elimination of Title 42. There's going to be another migration coming, and many of those folks are going to come to our region, and many of them are going to have legal status, and it doesn't matter whether they have it or not. We have to make sure we open our arms and continue to be our longstanding tradition of being a welcoming community. A lot of work, and I mean a lot of work, has been done by HHS, working with partner organizations, including SAMU, 7 days a week to prepare and to continue to provide services. So this puts us ahead of the curve as a region to be able to better prepare with the next migration that we know is coming soon.
Thank you. Councilmember Jawanda.
Yeah, just appreciate Chair Albornoz mentioned that. Just wanted to also thank the Joint Committee. We talked about this. I was just actually speaking with some folks at the White House yesterday. This is a huge issue that's coming right now, and we've had waves before, but the appropriate policy change, in my opinion, is going to we're going to get more folks, and we have to prepare. And so if there were a highest of highs, I know there isn't, but this is a big time priority. The work that's been done by our county, and as Chair Stewart knows, we've raised this at COG in my role at Region Forward and had a briefing, and we're going to need to do that again to galvanize the region around supporting our newcomers. And I'm just proud to be in a county that sees it as valuable and important, and really hope that we will get this not only on the reconciliation list, but off. Thank you.
Councilmember Fanny Gonzalez.
I just want to say that I am so proud to live in a county that welcomes people like me. It's not easy to leave your homeland and your family, and in my case, my brothers, everybody, to come here. We come for a reason, and America may not be perfect, but it's perfect for me. So very proud to have you all as colleagues and to work on executive on this issue. Thank you.
We continue striving for a more perfect union. So there you go. Great.
Okay.
Ms. Yao, we want to continue?
Sure. The Joint Committee recommended adding $200,000 to the reconciliation list as a high priority for the Children's Opportunity Alliance, NDA. Committee members recognized that this would bring the funding for the organization up to the fiscal year 23 level, considering that the council just made a special appropriation for the organization of $200,000. And they indicated the need for the COA to report on its completed strategic plan and work plans, identify specific contract deliverables, and delineate in collaboration and coordination with DHHS how the work would be conducted in this area.
Thank you. Councilmember Jawanda.
Yeah, I appreciate that. Just want to provide a little context. And you remember, we authored, Councilman Robert and I and others, and everyone supported the special appropriation. There was, not dissimilar to a previous item, there was some confusion, I think, between the executive branch and the COA about where that baseline of budget needed to be to do what they think they need to do. And so we had a robust discussion in the Joint Committee about this, and have urged both and been assured by HHS and by COA that there will be the needed and required collaboration under the law we passed a couple of years ago, so that we can do what we all want to do for our kids and expand this early care and education. So we feel like this is important as well to move that and to signal that and to move the work forward. So thank you, Mr. President.
Thank you.
The next item is the new school-based health center at South Lakes Elementary School. This is a CIP project that's being completed, and so there's a recommendation as a high priority by the executive to, the executive recommended this, and the Joint Committee recommended putting this on the reconciliation list as a high priority to operate this center. It includes $185,346 for nurse staffing and 1.88 FTEs, as well as an item of $409,713 for operating expenses. And the Joint Committee also recommended adding $300,000 to the reconciliation list as a high priority for the George B. Thomas Senior Learning Academy contract. The executive recommended a 50% reduction to that contract, which results in a $560,337 decrease based on the low numbers of children that are being served in this current fiscal year. However, the committee recognize the importance of these services for helping student achievement, and recognize too that the number of children served to date may not reflect accurately what they may serve for the whole fiscal year. So they recommended putting back $300,000 again as a high priority.
I'm going to jump in here and ask the administration if you could just elaborate to the full council why that reduction was proposed.
Good morning, everyone. Wait, is it still morning? Okay, feels like we've been here for a long time. So I'm Dira Trudvance, Chief of Children, Youth, and Family Services for the record. The provider, for the reasons expressed in the packet, it has been not just for this fiscal year, but a historical underperformance in being able to serve the target population. And on top of that, the intended affinity, the intended racial and ethnic groups that this particular initiative seeks to support. I know that we've been informed that there's been they've struggled in this past year because MCPS did generate a tutoring program that was free. George B. Thomas is fee for service, so they are struggling, which was new information for us because I personally wasn't aware of the MCPS program, but it was proposed just because of the history of underperformance, which is not new.
Okay, I appreciate the insight as to why that recommendation was made. I do support the Joint Committee recommendation, how important this program is and the population it serves. So I'll support the recommendation as presented. Councilmember Sales.
I yield. Thank you.
Okay, we're good. Ms. Yao.
Okay, moving on to the HHS CIP amendment for High School Wellness Center and Expanded Wellness Services. The Joint Committee recommended approval of the executive's recommendation to change the funding source for $1 million of the project from GO bonds to state aid. The committee also recommended language in the project description form that memorialized previous decision that the Joint Committee made that would maintain program capacity in the project, but remove references to specific expansion sites, and the Joint Committee also requested that DHHS perform a comprehensive analysis of need and convene the School-Based Health and Wellness Center Advisory Committee to determine recommendations for the priority order of schools that would receive high school wellness centers.
Comments? We're good.
That's it.
Okay.
That does conclude the review of the DHHS budget.
I got way ahead of
budget.
ourselves at the beginning.
That's everything.
So procedurally, let me just understand, we did a very thorough overview, and while they are delineated in different items here, we went through items 33 through 30...
Through 42.
Through 40, okay, 38, yeah, 40. Great.
42.
42, oh, okay, there you go.
We did everything.
Again, you got ahead of me. Any general comments, colleagues? Mr. Chair? Okay.
No, great job, everybody. I know we covered a lot of information there. I once again appreciate the staff's work that made it easier for all of us. And I would move the overall committee's recommendations as was noted as we went through the packet.
Very good. Councilmember Balcom.
I just want to thank our staffs. For those of us who aren't on the HHS committee, this is a big packet, and they've been monitoring and following this. So I just want to shout out Holly Mancuso, and I'm sure everybody feels the same way. So thank you for our staff.
Thank you to our staff. Councilmember Mink.
Yes, second that emotion. and also just wanted to express appreciation for my colleagues. I think that this has just been a great example of democracy working, and really appreciate that we're able to have these conversations in which we bring up new information and people are free to change their minds, and the decisions that we're making are not political, but rather based on the needs of our constituents. So much appreciation, grateful to be in this county and part of this body. Thank you all.
Thank you. I'll just conclude by expressing my appreciation to the HHS committee, which I fondly remember serving on last term. And so there is a lot of work, and these conversations that we just scratched the surface today will continue. As was just noted by Councilmember Mink, the regional numbers regarding the homeless population, the people who are unhoused, that came out just yesterday, ever relevant in today's conversation, but we need to continue that conversation and go a little more in depth, and look forward to having that team fully in place starting Monday. But for all of you, thank you to the department. Thank you to Dr. Bridgers for manning the ship. Look forward to future conversations about the department and its leadership. And I appreciate you all. Councilmember Sales.
Thank you, Mr. President, and thank you everyone for your comments, and to my colleagues as well. I just wanted to add to the record my affirmative support for the consent agenda, as well as items number 30.5 and 31 and 32. I believe I missed those two votes as well. Thank you.
Very good. Councilmember Mink, I think you want to...
Yes, the same. Thank you.
There you go, ditto. And Dr. Bridgers, I'll let you want to make a comment?
Thank you, Council President Glass. I pride myself on being a servant leader for our countyans, and as I like to close, we will get there together.
Thank you. And I just want to close on the comments, or picking up again off the comments that Councilmember Mink noted, that this entire budget process is unlike one that we have ever had, at least in my observation of county government and council government. And it is the most transparent process we have ever had, where we are going through line by line, and it is requiring us to be here longer. It is still morning by 2 minutes, by the way. And that is how it should be. And with that, all those in favor of this Department of Health and Human Services budget, and that is unanimous. And everyone have a good morning. We're in recess.